Okay, today we're going to be talking about the role of Aboriginal and Torres Strait Islander-led research in health, including implications for COVID-19 and eye health more generally. I'm Jackie Adams-Barton. I'm the Director of Program Implementation for the Oceania Cluster at the Fred Hollows Foundation. I'd like to start by acknowledging the traditional custodians of the land in which I'm on today, which is the Larrakia people. I pay my respects to the elders past, present, and emerging. I was born and bred in Darwin, and I'm fortunate enough to be of both Aboriginal and Torres Strait Islander descent, with ancestral links to the Yatagana and the Wuthupi people of Cape York Peninsula in Queensland, and traditional family ties to the Gurindji people of central, western, northern Australia. We're lucky to be joined by Janine Mohammed today, the Chief Executive Officer of the Leuchttur Institute. Thanks so much, Janine, for your time, for the discussion and your interest in the discussion. It's such a privilege for our listeners, but also an honour for me personally. Would you mind, Janine, just giving us a bit of an intro to yourself?
Yeah, sure. Thank you for having me, Jackie. I'm, as you said, the CEO of the Leuchttur Institute, but really my background is in nursing, midwifery, workforce more broadly, and then I've worked in the community-controlled health sector. And this is the second organisation I have the honour of leading. I'm a Narungagana woman, mum of 5, and I'm coming to you today from the lands of the Wurundjeri people of the Kulin Nation, to which I pay my respects.
Thanks, Janine. And I hope you're nice and warm where you are.
I am, but you know, the numbers at the moment are climbing here in Melbourne. So, you know, it's you're not going outside very much at all.
Yeah, it's still really hard to fathom this COVID pandemic, isn't it? I mean, in Darwin, we're kind of untouched and we're in summer and it's beautiful. But my daughter's in Melbourne and she's locked up and has to wear a mask. So, yeah, crazy.
Yeah, it is crazy and it's surreal. And, you know, coming from a healthcare background, that hypervigilance that you know that you have to have stays with you all day. So you sort of can imagine the virus almost being everywhere, and of course that's what we want people to be, you know, thinking about constantly, the techniques that you need to adhere to stop the spread of the virus, of course. But it means that you get very tired of thinking about it.
Definitely. So today we're recording this for a global audience. So many people might not be aware of the Leuchttur Institute. Janine, could you describe what the Leuchttur Institute is and what the kind of work that you guys do?
Yeah, so we've been around for more than 20 years now, Jackie, and previously we've been a cooperative research centre. And I suppose the research that we've commissioned with our Aboriginal Torres Strait Islander researchers really has shown what can be achieved when Aboriginal Torres Strait Islander cultures, our knowledges, our priorities, and of course the leadership, when that's placed at the centre of work, how we can make gains to improve the health and wellbeing of our peoples. Our work, you know, over that last 20 years has really fundamentally changed the narrative of Aboriginal Torres Strait Islander research in Australia, and I hope we get to talk a little bit about what that narrative has been in the past. But really, Leuchttur is about doing research for and with Indigenous peoples, not to Aboriginal Torres Strait Islander peoples. So that the CRC structure, you know, didn't always allow us to work with Aboriginal Torres Strait Islander communities to the extent that we wanted and needed. And now we've become an Aboriginal community controlled organisation, which means all of our governance are Aboriginal Torres Strait Islander peoples, which now allows us the privilege, you know, to work more closely with our mob when it comes to allocating research funds. And of course that, and then in turn ensures that Aboriginal Torres Strait Islander people drive our research agenda more strongly, which, you know, a large focus of our research is not just about doing the research, but it's building capacity of researchers. It's about the knowledge translation back to communities and up to government. And of course, it's about measuring the impact. So the other parts of Leuchttur really are about advocacy and workforce development in conjunction with, you know, commissioning research itself. That's Indigenous-led research.
Yeah, that's awesome. And big congratulations to Leuchttur and yourself, Janine, on the transition to a community-controlled organisation, major achievement, and especially special in these times when we're still talking about, Black Lives Matter and racism and having a voice for Aboriginal and Torres Strait Islander people. Also really interesting, and important to hear why it's important to have community control in research. Did you want to think further on that perspective?
Look, I suppose Leuchttur is built on those priorities that are identified by Aboriginal and Torres Strait Islander people. So every year, Jackie, we have a conference, and of course you came to our last conference, which was up in Darwin. We had unprecedented numbers. We had people on waiting lists. But out of that amazing conference, we had a conference statement which really talked to the priorities for communities and representatives in the room. We took that conference statement, and then our Research Advisory Committee, which is made up of Aboriginal researchers, took that conference statement, and that actually formed our commissioning of research themes, if you like. And from that, then once they'd decided on the themes, that went to our board for endorsement. And so what we have now, we've just opened up a new round of project grants for research, offering up to $200,000 to Aboriginal and Torres Strait Islander organisations and communities to, I suppose, apply for the grants. And to be eligible, they need to address two very key criteria, and that is that the research meets the needs of Aboriginal and Torres Strait Islander peoples, and it results in improvement in Aboriginal and Torres Strait Islander health and wellbeing outcomes within a generation. And we're privileging Indigenous orgs in that, and Indigenous researchers as well.
Yeah, that's great. So in the first of these sessions, Janine, we had Dr. Chris Raleigh-Baker, our only Aboriginal and Torres Strait Islander ophthalmologist in Australia, and he talked about culturally safe healthcare and institutional racism in the healthcare system. For you, Janine, what's the role of culturally safe research in health?
Well, I've probably quite a long history in cultural safety, and I was involved in embedding cultural safety as a notion, if you like, into the codes of conduct for nurses and midwifery, and also into the learning standards. So it's not dissimilar. It's really, in terms of research, a very important key component of cultural safety is understanding historical truth-telling and intergenerational impact of past wrongs. So, what we have to remember is research is often steeped in Western world views. So we want to decolonise, research in that way, so that Aboriginal ways of knowing, being and doing are really integrated into research. For many years, Aboriginal and Torres Strait Islander peoples were locked out of research, from invasion or colonisation, whichever you choose to call it. Aboriginal and Torres Strait Islander people weren't a part of research. They were the ones that had research done to them. And of course, we know in Aboriginal and Torres Strait Islander communities, the atrocious medical experimentation that was done to us in the name of research, survival of the fittest and Darwin's theory. And of course, then we have to understand the intergenerational impact that that's had for both Indigenous Australians, where we're very wary of research, and non-Indigenous Australians who do research with Aboriginal and Torres Strait Islander communities have to be very cognizant of what research has meant for us historically and the way which we are, viewed in that research bubble. So, more contemporary to today in research, what we know is that the design process and outcomes of research will most often reflect the lens of the researcher. And when health research is not done by Aboriginal and Torres Strait Islander peoples, this means our ways of thinking, being and doing are, largely missed out. And of course, we know historically as well that the research never gave back to Aboriginal and Torres Strait Islander communities. Often it was detrimental to them. So firstly, what we want to see is research being led, designed, conducted by Aboriginal and Torres Strait Islander researchers, and that's why our research agenda and that commissioning process privileges Aboriginal researchers and community-controlled organisations. But when this is not happening, cultural safety is absolutely critical. So, as you know, cultural safety is different from cultural awareness. Cultural awareness is about the gaze being outward, if you like, and examining. Aboriginal and Torres Strait Islander communities and our cultural nuances, but cultural safety is a self-reflective process. So it's really about turning the gaze back onto yourself and understanding your own biases, that intergenerational stuff, and the beliefs that we've been fed, including racial profiling and what people think about Aboriginal and Torres Strait Islander peoples, and really understanding where those beliefs and biases come from. And then understanding how to deal with that, most importantly, individually, in an organisation and systemically, and really understanding that cultural safety as a practice is a lifelong journey. And when this happens in research, we're more likely to see the aspirations of, our people's aspirations reflected in the research outcomes. And I suppose the other thing to point out is that research should be done in very situationally. So I think there's a notion out there which is culturally unsafe that all Aboriginal Torres Strait Islander peoples are the same. We're homogenous. But we know, if we look at Tyndale's map of languages, we are beautifully diverse, and that means we're very diverse in what our needs are around research as well. And that's why we have so many ethics committees, and that's something that is still needed.
Yeah. So I'm on the Menzies Ethics Committee in Darwin, only for 12 months now, and it's such an eye-opener in terms of just the misunderstanding and the types of motherhood statements out there that people don't actually take the time to understand culture and what culturally safe research means for our people.
Yeah.
So
I think the biggest thing I've seen, Jackie, is where the problem is placed with us in the research, as opposed to the problems we face, and therefore it's a systems problem that locks us out. So and when you do cultural safety, you unpack all of that and you realise where you're positioning yourself and where you're positioning Aboriginal and Torres Strait Islander people.
Yeah. And we talk about values of respect and, knowledge exchange and reciprocity.
Reciprocity, absolutely, yeah.
Oh, yeah, I never know how to say that word. Which are big words. So how do we research to make sure that, someone who doesn't have my kind of education understands what that actually means for them and what they're right?
Hi, I'm so grateful for spell check. Saying it's one thing, then spelling it's another.
Yeah. So in terms of culturally safe research, is there a role to play in the continued management of COVID-19?
Yeah, I think so. Like in terms of COVID, there's so many lessons that we're learning from overseas. In that Indigenous communities around the globe and minority groups are the most vulnerable. And this is not about health conditions and burden of disease, but about how the system itself treats people of colour, treats Indigenous peoples within that system. And also, a little bit like our conversation just then, it's about past experiences of racism and whether as people of colour or Indigenous peoples, minority groups, whether we want to access that system or whether we leave it to the last minute. And then when we're in that system, we know, and it's evidence-based, that we get downgraded healthcare pathways. So culturally safe research allows us to see what's happening on the ground for our communities. And it means we need to have communities that have embedded research, in their priorities as well, and that research is responsive and tells us what works well, as well as what's not working.
Yeah.
So culturally safe, and I think probably research that's timely. I think that often when I've sat around national tables, it's really hard to get data that's still relevant. I remember days when you'd have to wait 5 years to get data back to community and back to the board tables so that we could do some planning based on the data and the research. So timely data is really important as well, and that we have, of course, data sovereignty over that.
Yeah, for sure. So currently in our Australian context, a lot of the research in relation to Aboriginal and Torres Strait Islander eye health is led by non-Indigenous organisations and non-Indigenous researchers. Janine, I wonder if we could chat some more about some of the reasons for this and how we might change this going forward.
Yeah. Look, I think that Aboriginal and Torres Strait Islander leadership in these areas is critical, and I suppose, you know, to play on the topic here, there's a bit of a blindness, isn't there, Jackie, in who actually needs to be placed at the centre. There's been some really good, you know, responses to trachoma and eye health over what I would say many years. And I think we've learnt a lot from that, you know, and that's applicable to other infectious diseases like RHD, you know, otitis media. You know, for example, Fred Hollow's foundation worked to eliminate, you know, trachoma, and the roadmap for close the gap for vision, which is done with Melbourne Uni, I think, with Professor Hugh Taylor, has been a great model for engaging government to act and, you know, really have again, to play on the word, a visionary pathway for everyone to work. But as you say, this is largely led by non-Indigenous organisations. And, you know, I suppose a reflection of that is these organisations that lead the way, they really, I think, have examined their governance systems over the years, you know, to add Aboriginal and Torres Strait Islander peoples to their board, to their staff. But there's, you know, I think the partnerships are often what's key when programs are led by non-Indigenous organisations or government. And the key to success is the relationships that are developed with Aboriginal and Torres Strait Islander peoples. And that's a constant, you know, that's a constant question that I think these organisations have to have, you know, leading into the future. Are they handing this work over to, you know, to Aboriginal and Torres Strait Islander communities? Are they building their capacity to one day take over this work, which is really ultimately what we want to see. And the Leuchttur Institute, as a community-controlled research institute, you know, we're looking to support research led by Aboriginal and Torres Strait Islander communities and organisations so that it meets the needs of Aboriginal and Torres Strait Islander peoples, and you know, in eye health and more generally speaking, health and wellbeing. So I think a key challenge for the Leuchttur Institute is resources, but our strength lies in those connections with other organisations as well, both Indigenous and non-Indigenous.
Yeah, I mean, the Fred Hollows Foundation is a non-Indigenous organisation, you know, to have some amazing Aboriginal and Torres Strait Islander people within our team, but we also have, you know, some great policy and advocacy and engagement experts to support us, lead us the right way. So internally having the right expertise and resources, but as you say, it's about, you know, building relationships and building respect and trust, and acknowledging that, you know, we won't be there forever and a day as a non-Indigenous organisation. So how do we build the of the people on the ground and allow them to make the decisions and tell us what they need in terms of eye care for their community? So yeah, it's definitely about changing the approach. And I think, you know, we pride ourselves as a foundation over the last 10 years at least to be working with the eye care sector to change it from, you know, consultation for consultation's sake to actually be about sitting on the ground with people and having a discussion about what works for them or what won't work for them, providing them with the tools to make a change, but also providing, you know, the expertise and the extra hands, so to speak, to get some things done on the ground in terms of improving eye care, which we hope then improves health in general for Aboriginal and Torres Strait Islander people.
Yeah, so that's, you know, building that capacity. I always, as you know, Jackie, talk about we're 3% of the population, where the power and a lot of the money and resources lie is with the other 97%. So that really lies on allyship, you know, and true meaningful allyship. Exactly as you said, is built on trust. We will only ever travel at the speed of trust. And it also really is an acknowledgement about power balance. And that's why I mentioned, you know, permeating non-Indigenous organisations with Indigenous peoples, but also sharing that power and leadership with those peoples within that organisation. And ultimately devolving that power out to communities and building their capacity. And that's what a culturally safe and allyship model for me looks like.
Yeah, definitely. So I'd like to talk a bit now about the Aboriginal and Torres Strait Islander leadership during the COVID-19 pandemic, which has been acknowledged as extremely successful in preparing Aboriginal community-controlled health services and in limiting the spread of the virus amongst Aboriginal and Torres Strait Islander communities, our most vulnerable populations. So Leuchttur wasn't a part of the National Task Force specifically, but Leuchttur did play a role and most notably worked collaboratively with the Royal Australian College of General Practitioners, the Australian National University and the National Aboriginal Community Controlled Health Organisation to develop primary healthcare guidelines to support COVID-19 prevention and management. So from your point of view, Janine, what are some of the key elements of this leadership, especially in the way it works with government and vice versa?
I thought you were going to say most notably was our I'm a Survivor video that we did, which was really about public health messaging and really getting our staff educated in that process as well. But yeah, look, that was that piece of work that you're talking about, the rapid reviews, was a result of what I would call our Black influencers on Twitter and really calling for some clear messaging out there. So, so the partnership between RSCGP, NACHO and ANU really was aimed at ensuring that, questions that healthcare workers or Aboriginal health services and other primary healthcare workers, when they submitted to us, that we had a collaborative and quick response in developing these series of rapid reviews to assist in COVID. So Leuchttur's bit of work in that was funding it. We also had an initiative with the National Aboriginal Torres Strait Islander Health Leadership Forum, where we developed an expert database to help Aboriginal community-controlled services to search for experts, I suppose with the necessary skills to assist and support communities in managing the COVID and other diseases. So that was another, I suppose, leadership piece that we did in COVID. But regarding the Aboriginal and Torres Strait Islander leadership in the pandemic, hasn't it been an extraordinary response, from Aboriginal and Torres Strait Islander peoples? Like, we've really overperformed, like we always do. All of us have been brought up saying you've got to be better than, but we've really outperformed, the rest of the community in preventing the spread of the coronavirus. And the figures that I've been given is that as of mid-July, 60 Aboriginal and Torres Strait Islander peoples have tested positive for COVID so far. None of them have needed intensive care, and none of them have died from the virus. We're watching obviously closely, as I said at the beginning of this interview, what's happening in Victoria. Bacho here in Victoria showed great leadership with regard to warning communities that this is really serious business for our communities at the moment. But we know that the impact of infectious diseases, like I've rattled off the infectious diseases that we experience in this country. We're a first world country. We experience third world, health outcomes and infectious diseases. So we knew how to respond straight away, and especially in shutting down remote communities, exercising our sovereignty, as I put it. I just think we were so nimble and we were so creative. As a community, our comms was great, especially through the Aboriginal community-controlled health sector. And from what I saw, anyway, on social media, we had lots of fun, translating it and going to various age groups and various mediums. That old Aboriginal grapevine really held us in good stead.
Yeah. And I mean, it's amazing out of a pandemic that, the role of Aboriginal community-controlled health services shines through. It should have shined through a long time ago. And the work that Aboriginal community-controlled services have been doing is astronomical, but we've never shined a light on the positivity of it. So I, for one, and really proud of the sector, but also of Aboriginal and Torres Strait Islander people. We have the highest burden of disease in this country. As you say, we still live in third world conditions in some areas, and we don't have access to all the healthcare or eye care that we need in many areas, including in urban areas. So to come out as the shining light of this is the example of how you get through a pandemic more successfully, it's just brilliant. Something to be everyone should be,
Pat on the back, hey. And I think, like in this instance too, I think it showed that governments actually listened, not just heard us, but listened deeply. And I hope they listen now, as you said, Jackie, that we don't have to continue to spruik our value add, that we are an integral, needed part of the healthcare system, that they continue to fund without question, and they see us through a strengths-based lens, as opposed to all of this money that they're pouring dollars in, this system that they're pouring dollars into, and what do they get out of it? So this is what they get: an amazing healthcare system.
Yeah. And it's really interesting times, isn't it, Janina? Sorry, I'm going a bit off script, but yesterday the announcement of the national agreement closing the gap in Australia, which is instrumental change in the way government is working with and for Aboriginal and Torres Strait Islander people at the most national level, but down to every jurisdictional level. And we have our Prime Minister standing up there saying how great Aboriginal community controlled is, what benefits and strengths they have, that funding, has been wasted and not targeted in the right areas. So how do we, I guess this, as I said, I'm going off track, but how do you as a leader in the Aboriginal and Torres Strait Islander health space take that? It's not hope anymore, it's actually real. So how do we take that forward and not lose that momentum?
Oh, I don't think we will. As Indigenous peoples, we know the legacy that we inherit. And that's why it's never a job, it's our life, what we do, because we're literally working for our own lives and the lives of our communities. So I think that will always be our driving force, our momentum in doing this work, even though at times we need time out from it, because in itself it makes us ill. Having to constantly be in there advocating, proving yourself takes its toll. But I think the narrative has changed in government. They, like you said, they actually knew who Aboriginal community control was. As you know, I worked for the sector since 2002 right up until 2014. So, fair chunk of my life in Aboriginal community control. And I remember visiting Parliament House in the early days, and they didn't even know what Aboriginal community controlled health services were. So we have become, a known entity within the halls of Parliament, and I think that, we know as Indigenous peoples, we'll continue to build upon that. But that opportunity has not come just because of my leadership or anyone else that sits around those national tables. That's built on the shoulders of giants that have come before us.
That's right. And I always say, I'm in a non-Indigenous organisation. That thing about we live and breathe this is not always understood, and it's not understood because you don't live and breathe it, and it's really hard to tick that and get the support that we need to make a difference. But I think we just, like you say, we're a very resilient mob. We don't take no for an answer, and we know that we shouldn't give up, and neither should our children and their children, in terms of ensuring Aboriginal and Torres Strait Islander people have the rights and also have the right to health.
But like how do we keep that going? Hey, like you said, Jackie, and that's through non-Indigenous people's families talking about this with their kids, and then taking on personal responsibility, because in the nursing arena, one nurse will talk to another nurse. A lawyer will talk to another lawyer. Doctors talk to doctors. There's that, that professional, I suppose, reciprocity and respect that's there. And I think non-Indigenous Australians need to talk to non-Indigenous Australians. And I think one of the things that I've always tried to highlight when I yarn in situations like this is that the NAIDOC event, the Reconciliation Action Plan, shouldn't all be left up to the Aboriginal person in an organisation. True allyship is about other people, pitching in as well and doing their own personal learning. Because I don't know how many times I've been asked to speak on behalf of the whole Aboriginal population. And then I talk to my non-Indigenous colleagues and I say, well, do you get asked to talk on behalf of white Australia all the time? So I think when our allies learn those sorts of things, they begin to understand that this is something that we have to share the load with into the future, and that's another part of how we keep this work going. Because as you said, we get tired, and we need our mates to come alongside us and learn this work with us.
And we do have amazing support and commitment and positive intent from many of our non-Indigenous colleagues, and celebrate that. It's not something that we want to move away from, but I think Australia in general, the non-Indigenous population needs to be more informed, needs to take the time out to get informed, and I guess that's what that truth telling is about, and having a voice in Parliament is all about.
Yeah, and that reflective practice of not knowing what you don't know, and really understanding yourself and your biases, and make a concerted effort to that if we want a better Australia and we want national pride.
So again, Janine, I'm going to go off track, but from the COVID pandemic that we're experiencing at the moment, there's a lot of emphasis, rightly so, on mental health and trying to remove stigmas about it, but also providing the right amount of support for people in times like this where it's unprecedented. We've never had this before. We kind of don't know what we don't know. Is there much research coming around mental health in terms of Aboriginal and Torres Strait Islander peoples in the COVID situation?
So Dr. Pat Dudgeon has done an amazing piece of work, a report that is actually up on the Leuchttur website. I believe we tweeted it out at least anyway, and I can share that perhaps to you guys so that you can put it up as a part of this podcast. But I think that has some amazing signposts in it. I actually personally talked in it, and there's some great scenarios in there about how communities, Indigenous communities have lost loved ones and have to bury them, not being able to practice ceremony during these times of COVID. How our very own Aboriginal Torres Strait Islander health professionals are coping during this time, and the stigma attached to them, of course, being in at the forefront, if you like, at the very front lines of battling COVID, and having to self-isolate, having to treat community during these times. So that's a really great report. I don't think you can have enough information out there. So I think there's more resources that need to go the way of amazing people like Pat and her team, who are IEPA, which is the Indigenous Psychologists Association.
Yeah. And mental health touches all of us. I'm sure everyone's got a story about how this COVID pandemic has touched us in terms of losing loved ones, changing our family structures, how we reach out and get support from people, just being as we used to be has totally changed.
And even, that intersectionality that we had with the Black Lives Matter campaign, and, how people who marched and their supporters, how that was treated in the media. Of course, we had non-Indigenous peoples on panels talking on behalf of us, as well as, people really questioning why we were doing this, instead of understanding why we were doing this. It was so important to us that we would do it at this time, and turning that narrative around. So to really understand that deaths in custody, particularly preventable deaths in custody, the trauma, and no one ever being brought to account for those deaths in custody, really brought us out in our numbers, because we felt so passionately about and wanted to support those families, and it really resonated with so many Indigenous peoples and our allies. Yeah.
It's interesting though that those kind of activities, which are definitely needed, and we definitely have a lot of support, it also brings out the ugliness of our society too, doesn't it?
Yeah, Australia Day is another one where I stay off of social media.
Yeah.
But I suppose it says something to the Australian conscience. Why do we get so fragile and upset when we discuss race and racism in this country? I think for many of us as Indigenous Australians, our family have talked about it long and hard over our dining tables. So we're really woke about what it is, and we're taught that because we don't have the privilege of not knowing about it. We have to understand racism so that we protect ourselves. For non-Indigenous Australians, there's something about their truth doesn't match our truth, and that's where we see this rubbing up against each other and very different worldviews, and we get the cognitive dissonance, and that's often met with fear. And I think that's what if I was to describe an emotion that I see most of the time on Twitter, that is not a questioning, exploration or enlightenment type of conversation, but a blatant backlash. It's often, the essence of that is often fear.
Yeah, for sure. Fear and uninformed, or fear of the unknown as well.
Yeah, fear of what you might lose, or fear of actually having to face a different truth or learn a different truth. Yeah.
Yeah. So on a more positive note,
yes,
Leuchttur obviously has many international connections, and we're very fortunate in the foundation to have used the Lancet report, which Leuchttur was in, particularly around indigeneity for eye care in the in which we work. So we're a global organisation, and we specifically focused on some case studies, obviously Australia, our Indigenous Australia program in Kenya and in Cambodia. So we're trying to inject the thinking around indigeneity and eye care for marginalised groups and Indigenous people in countries in which we work. So got a long way to go, but we're definitely passionate about that and want to take that forward. I was just interested in terms of Leuchttur, you have many international connections, and whether you said earlier that you're learning from overseas in terms of this COVID pandemic and our management and our research around it. Could you tell us a little bit more about that international space?
Yeah, so, particularly other Indigenous communities around the globe. So you've got the likes of Janet Kelly, who's done some amazing work in Canada. She's also been involved in what I feel that Leuchttur Institute has brought to Australia from Canada, which is knowledge translation and research impact. And as I mentioned earlier, we actually fund that as a part of the activities of research. So when we give a research grant, part of the grant needs to be used around knowledge translation. So if you like, it's a bit of a trade and reciprocity between Indigenous peoples that, we've used their knowledges that really obviously, when you travel around the world and you meet other Indigenous peoples, there's just this commonality, this thread through us all, and this love of working with our own mob. And so we've traded or taken that Indigenous knowledge and really grown it here in Australia. Of course, it has to become our own and, be fashioned in the way that needs to work for our communities. But that's just one example of how, as Indigenous peoples of the globe, when we work together, we do amazing work.
That's awesome. And now you've said, you're just showing off because you've said reciprocity 3 times without any struggle at all.
I practice before I come online.
But in all seriousness, thanks, Janine, so much for your interest in having the discussion with us today and for the IAPD audience. Definitely a lot to think about, and we could talk all day. I'm sure you and I don't have that time, unfortunately, but really appreciate your time and your interest and the work of the Leuchttur Institute, particularly in terms of, your leadership at Leuchttur, but, just across the board. Please stay safe in Melbourne. Difficult times at the moment. We've got staff in Melbourne and Victoria as well, so we're worried for them. And as I said, my daughter's still there at uni, and she made the adult decision not to come home at the beginning of the pandemic, and I wasn't happy with that, but now I have to live with it. But yeah, let's all just hope we get a COVID vaccine sooner than we think we're going to get it. So thanks, Janine.
Oh, thank you for having me. And it's a terrible thing when Black mothers don't have control anymore. Hey? Whole new level of parenting.
Thanks, Janine. Take care.
All right. Love to you all.
Bye.
Bye.